Well, as lawmakers face a looming deadline, health care reform continues to heat up in Congress, but at what cost to the industry? Bloomberg's Lindsay Aaron has the latest on the state of play on health care from Washington. Lindsay.
Well, Betty, a ton of action here in Washington, and especially on Capitol Hill when it comes to health care. We've got legislation advancing in 3 House committees, talks going on in the Senate Finance Committee. That chairman, Max Baucus, the Democrat, is gunning to try to get a compromise together to create a bill to unveil by tomorrow in order to make President Obama's deadline for passage in each chamber before they leave for the August recess. Part of the struggle facing Democrats, though, was really finding new ways to foot the bill for this $1 trillion-plus overhaul of health care. Yesterday afternoon, Democrats zeroed in on one potential new source of funding. That would be the health insurance industry. Senator Chuck Schumer of New York says between 2000 and 2007, the top 10 health insurers saw their profits rise by 428%, reaching about $13 billion in 2007. Now, Schumer says it is time for industry to give back.
We believe that the insurance industry should help pay a significant part of the increased costs of health care.
All right, so how much are we talking about here? A minimum of $75 to $100 billion, Schumer says, and that would be raised by assessing a fee on health insurers. Industry lobbyists say that this new tax could potentially just make health care costs that much more expensive for consumers.
We already pay a significant tax burden, and adding to that is only going to make it more difficult for people to afford the health care they need.
Things are happening fast and furiously as we speak. We just heard that House Speaker Nancy Pelosi a short time ago told reporters she's open to reducing the rate that high-income Americans might be subject to under the House bill. So basically, Betty, everything is negotiable at this point.
But Lindsay, I mean, tell us what to expect today on the table with health care.
I mean, really, there's just so much happening. I have to tell you, there's a major charm offensive underway by the president. A little bit of arm twisting, too. He invited 2 key senators, Olympia Snowe of Maine, along with Ben Nelson of Nebraska. These are swing voters on this issue in the Senate Finance Committee. Invites them to the White House to say, hey, look, what can we do to make this thing happen? Also, a lot of press conferences and meetings ongoing as we speak. We'll keep on top of it for you, Betty. Back to you.
Okay, Lindsay, thanks very much. Lindsay Aaron in Washington.